Okay.
Hi, everyone. This is Dr. Joseph Anton with L-Nutra. And today I have the pleasure to talk to Tim, who's a diabetic patient that has tried our program, the Diabetes Remission and Regression Program. I want to talk to you, Tim, today about, first, want to learn a little bit about who you are, and then, what kind of stage of diabetes you had, and then your experience with the program, and what are you here today and in the disease progression, as we all know, and when I personally went to med school, they've taught us this is a disease that keeps progressing. You start with one medication, and then two, and then three, and then complications, and then death. And I think here we're trying to reverse the course of the disease. So a pleasure to have you, Tim, and thank you very much for your time today.
Of course, of course.
Do you mind telling a little bit about, tell us about yourself?
Sure.
Yeah.
Yeah, so we're here in the Atlanta area, and I've come into this program mostly because my wife has previously done this herself for several years, actually. And so I've just completed my 4th round of the L-Nutra fasting for the diabetes specifically, and I've had really, really good results. I'm looking forward to continuing to progress in this. One thing exciting, I've lost like 13 pounds, so that's good. Hopefully I'll keep that progress going. And my diabetes medication has gone down from, I was taking glimepiride, I was taking 3 pills at the beginning of the program, and then in the middle of the program, I went down to 1, and right now I'm on 0 pills, and we'll see if that will continue as we go forward into the next couple of rounds. Hopefully we will reverse this whole process.
So Tim, you've been doing it for 4 months?
Yeah, 4 different rounds each, 5 days each month for 4 months.
So a total of 20 days of our fasting mimicking nutrition.
That's exactly
guided,
right.
And the nutritionist guided program. So just to explain to everyone, this is a program where we're shipping you a box. I actually have a box here behind me. It's a box that contains food. The food is scientifically developed, and the formulation is proprietary and is patented to simulate a fasting state in the body, right? So diabetes mainly is a disease of 3 things, right? It happens with aging. This is very important. Even if you were a little bit overweight at 25, you did not have diabetes. And number 2 is a little bit of a lifestyle of stress and overeating and a little bit of sedentarity. And then number 3 is the muscle loss that happens also with age. And when 18 universities came together to discover this fasting mimicking nutrition and test it, and it was tested to actually impact all 3 pillars of the root cause of diabetes, right? So the aging. So when you do this program, and probably you feel that day 3 is a little bit that transition day and a difficult day, this is when the cells start rejuvenating, and they get biologically younger. So we're helping you, Tim, to be a little bit younger personally, so because a younger you is a better you in processing metabolism and having vibrant cells and all of that. Number 2, the box is a fasting mimicking, so your body thinks you're not eating, and diabetes is a disease of a little bit excess of calories and excess of insulin, insulin resistance. The best way to reverse it, in our opinion, in our science, is not taking pills, but is actually reverse that state. This is the second way the fasting mimicking diet box impacts diabetes. And the third way is muscle protection, and this is critical. And looking at you now, you don't feel like I lost weight and I'm feeling down. You feel probably, and you can express it, energetic or empowered, or
I feel strong. I mean, I do feel like during the fasting time, I work out basically every other day, and so during the fasting period, it does feel like I'm a little bit weaker, but then soon thereafter, I feel like I get stronger. So it's been really good. So
it's critical, because this is where the Wegovy's and the Ozempics, as everyone knows, they were used for diabetes before they went for weight loss, and their demise is that you have to take them forever, and they have a lot of side effects. But if you stop them because you lose a lot of muscle, this is how diabetic patients are not able to get off those, and this is why the fasting mimicking nutrition is key. And so here, what you did is you do 5 days per month. We're shipping you the box, which again is this box of food sitting here behind me.
Yeah.
And then you do month 1, just 5 days.
Yeah.
Then 25 days, you go on your own. 5 days, second month, third month, and now fourth month.
Yeah.
And you're saying you started with 3 medications,
Well,
and now you're
three pills. The glimepiride I was taking at the very beginning, and then in the middle of the process, maybe a month two, I cut back to one, and then in the last month here, I cut back to zero. May have to go back on. The numbers are going up a little bit right now, but I'll check with my doctor on that.
yeah. And is your goal for the first time to be off diabetes?
Yeah, yeah, and to sustain a lifestyle. In addition, we changed our eating habits during the other days of the month, and we've moved mostly to a plant-based diet thanks to the nutritional help that you've given us.
That's fantastic. Wait, how long have you had diabetes?
I think it was diagnosed like maybe 6, 7 years ago, so a
And
while.
and were you feeling like this is a chronic condition that I'm going to live with forever?
Yeah, yeah. Well, and I see all the bad repercussions, and the sight loss, the weight issues, the loss of feeling. I have a mother-in-law who's much older that's had it for many years, and she is very numb in her fingers and her feet because of her diabetes. So I don't want to experience those kind of symptoms.
And Tim, for those listening to us today who've had diabetes for a period of time, I do come from traditional medicine. We used to, just tell them this is a chronic disease, you're going to live with it, and you're going to stick with it, and you're going to add more pills, and you're going to end up on insulin,
Yeah,
and maybe some kidney failure and amputation, and all the complications. What would you
yeah.
tell them today? What
I
do you what would you tell them?
I say it seems possible now. I'm anxious to get to the other side of this with the full regime, but I've already seen very dramatic results. And if we continue at this rate, I think maybe, hopefully, I will be off of the meds for good in another few months.
It's amazing. We're talking in months, not in years, and
Yeah,
this is just unbelievable. And again, because it works on the root cause, right? Diabetes is a lifestyle and nutrition, and yes, some predisposition and aging.
yeah,
This is the first program ever to tackle all three pillars of the root cause of the disease. I thank you very much today for
sure.
your time and for testimonial.
Yeah,
And I hope that again, thousands and millions of diabetic patients really take care of themselves and
yeah,
think outside of the kind of the traditional ways or the old ways of just relying on pills
yeah,
they're just controlling the condition, and try
yeah,
to think about reversal. We're limited by as much as our ambition and our self-care is, and let's take control of our health and try to make diabetes an option, not a doomed diagnosis.
yeah. No, it really works. And I'm excited about the progress already, and even more excited about the progress that will continue in the future.
Appreciate you very much.
Thank you very much.